Okay, this is my audience. Okay, I'm going to do a presentation on immunizations and why you should get your children immunized. So, have you or someone you know had the measles? More than likely, the answer to that question is no, and that's due to the invention of vaccines. Some people think that because the prevalence of diseases have decreased, that vaccinations are for nowadays, you don't need to get them. According to an article from the Children's Hospital and Clinics in Minnesota titled Frequently Asked Questions About Immunizations, certain diseases crop up so rarely now that parents sometimes ask if the vaccines for them are even necessary anymore. This is just one common misconception about immunizations. The truth is, most diseases that can be prevented by vaccines still exist in the world today, although they happen very rarely. There are also very many risks and benefits, but in an article titled Some Benefits and Risks of Vaccinations by Merck and Dome Corporation state, we all know that the point of vaccinating is to help prevent certain diseases. Some of those diseases can be serious. What's more, certain diseases are still common enough that not having your children vaccinated with the recommended vaccines may put your children at risk for getting infected. So the purpose of my speech is to tell you the need for vaccines, why it's important to get them, by getting vaccines, the benefits of them and how they affect you and others around you, and some resources and things you can do to ensure that you get the proper vaccines. So, why do you need vaccines? An article titled Immunized for Good by the Colorado Children's Immunization Coalition gives this example. Let's pretend there are 200 sixth graders at ABC Middle School, and 90% or 180 of them are vaccinated. Due to a major outbreak, the ABC Middle School is exposed to pertussis, or also known as whooping cough. The attack rate among the vaccinated kids is 16%. So 29 out of the 180 of the students get pertussis. However, the attack rate among the unvaccinated is 80%. So out of the 20 unvaccinated students, 16 become infected. This can make it appear as if vaccinated kids are at greater risk, but in reality, 80% of unvaccinated kids were infected, while only 16 of the vaccinated kids were infected. So that shows you the percentages of those who are infected, who get infected with a vaccine, and the percentage of those infected without. And according to an article titled Vaccine Basics, the importance of vaccine from Immunization Action Coalition, those vaccines has led to a dramatic decline in the number of U.S. cases of several infectious diseases. Some of these diseases are quite common in other countries and are brought to the U.S. by international travelers. If children are not vaccinated, they could easily get one of these diseases from a traveler or while traveling themselves. And if you look at air traffic, you can see how easily it is to get someone from a foreign country that has a disease that doesn't have the vaccination available to come here in the United States and go to your school or come in contact with them easily. It is important to adhere to recommended schedules when talking about vaccines and immunizations. Those schedules are sometimes hard to find, but getting them on time is recommended for a reason and is the best way to prevent a disease. And parents speaking up for immunizations from Voices for Vaccines, they say preventing disease requires on-time vaccination for your entire family, especially for children. With that in mind, childhood vaccine schedules are developed with great care to ensure that your children are protected from disease when they are most vulnerable and when their bodies are best able to build immune responses to different vaccines. So as you can see, there's a real need for vaccines for you and those you care about. So why is it important to get vaccines? How does that protect you or those around you? A common question is, why do you need a vaccine for a disease that is not common anymore? That's because the number of people who have these diseases is reduced due to vaccines. In an article titled Why Immunize Your Child by the American Academy of Pediatrics states, if vaccines were not given, the bacteria and virus that cause the disease could begin to infect more children again. For example, the HIV vaccine developed in the 1980s, there were about 20,000 cases of HIV disease in the United States a year. Today, there are fewer than 100 cases. However, that doesn't mean that the bacteria is gone. It still exists today. That is why children need the vaccine to be protected. In the United States, vaccines protect children from many diseases. However, in many other parts of the world, vaccine-preventable diseases are still really common. Because diseases may be brought into the United States by Americans who travel abroad or from people visiting areas with current disease outbreaks, it is important that your child is vaccinated. Vaccines are also important to protect those around you and the ones that you love, but they also protect others who cannot get vaccinated in your community. Here's what the Center for Disease Control says in an article titled, "What Would Happen If We Stopped Vaccines?" Most vaccine-preventable diseases are spread from person to person. If one person in a community gets an infectious disease, it can spread to others who are not immune. But a person who is immune to a disease because she has been vaccinated can't get that disease and can't spread it to others. The more people who are vaccinated, the fewer opportunities a disease has to spread. And here is a little picture I have to illustrate. If only some people get vaccinated, more people have the ability to get sick and get the disease. If most people get vaccinated, that number is reduced dramatically. This is something that is called herd immunity. Herd immunity occurs when enough people in a population provide protection for those who have not developed immunity. According to an article from Vaccines Today titled, "What is herd immunity?" this can effectively stop the spread of disease in a community. It is particularly crucial for protecting people who cannot get vaccinated. These include children who are too young to be vaccinated, people with immune system problems, and those who are too ill to receive vaccines, such as some cancer patients. Even if you choose to do one of the things, getting your children vaccinated or educating those around you, you'll be making a step towards decreasing infectious disease in those who have them. So some commonly asked questions are, how can we increase the number of those who can get vaccinated? Some of you may ask, where can I get information about questions in regards to vaccines? Well, I'll ask you this. How many of you have access to the internet or utilize social media at least once a day? The answer to that is probably multiple of you. By simply going onto the Minnesota Department of Health's website, you can find out what shots your child needs and when. And another question is, I don't know if I need my vaccines, or I don't know if I'm up to date on immunizations. Well, if you go to your healthcare provider, there's something that can be done called a titer. Titers can be drawn prior to immunization to determine if vaccination is necessary. That's information from A Parent's Guide to Vaccines. Another question that's commonly asked is, where can I go to get vaccinated if I don't have time to go to a primary care provider? If you don't know where to get vaccinated, here's your answer. In the article titled, "Where to Get Vaccinated" by the U.S. Department of Health and Human Services, it is stated that vaccines may be available at private doctor offices, public or community health clinics, or other community locations such as schools, universities, pharmacies, religious centers, or places of worship. If you have a doctor or regular source of care, speak with your provider about vaccines recommended for you and your family. You can go to vaccines.gov and click on the tab also, and you can type in your zip code and it'll tell you what places near you to get vaccinated. These are just a few things that will help you get vaccinated, as well as information you can provide to those you care about to get vaccinated. So we talked about the need for vaccines, why they're important, how they benefit you and those around you, and how you can protect your community from getting an infectious disease. But the Minnesota Department of Health says it best. Some people call them immunizations, others call them vaccination or shots. Whatever you call them, immunizations are one of the best weapons we have against a number of serious diseases.